Hi, everyone. This is great. We have a great turnout tonight. More people than I can see on one screen. I hope that doesn't make it hard to facilitate a meeting. But welcome. I know we have at least one person who I haven't met before, and so I would love to do a round of introductions. Why don't you call on the next person after you introduce yourself? And so I'll start since I'm already talking. I'm Megan Mack. I'm the chair of the partnership. I am a community member and I have a daughter in Arlington Public Schools in 8th grade. And I've lived in Arlington since about 2003. And I will pass it to Sally.
Hello, I'm Sally Labonte. I am the web coordinator for the partnership and for the teen site for arlingtonva.us. And I have lived in Arlington since the mid-late 70s. And I have a daughter in APS also in 5th grade. And I am about to be 11 years with the county. And I will pass it to Lynn, who's next to me. You can put it on gallery if you want to see everybody at once. I sometimes find that's more collegial, but I'm with you. So Lynn, sorry.
Got it. Thanks, Sally. Hi, everyone. I'm Lynn Ye. I'm the Provincial Director with DHS. I'm also serving as the interim DHS liaison for the partnership. Nice to see everyone here today. I'll pass it to Jamie.
Good evening, everyone. My name is Jamie Primdas. My pronouns are she and her, and I am the Children's Behavioral Health Bureau Director. And I have the honor and privilege to work with both Sally and Lynn in Child and Family Services at DHS. And I will pass it to Kim.
Hi, I'm Kimberly Baldini, Youth Services Section Leader with Parks and Recreation.
You have to pass it, Kim.
I'm never good at this. Okay, Judy.
Okay, Kim. All right, I'm Judy Haddon. I actually am not a partnership member anymore, but I keep coming to meetings because I'm still working on committees. I was on the original partnership, well, from way back when it started. So I figured it was time to make a space for somebody new. So, but I keep coming in anyway. I'm a member of the Partnerships Youth Mental Health and Wellness Committee, and also the Student APS Student Services Advisory Committee. And all those groups kind of work on the same thing. Thank you. And I'll pass it on to Robert.
Hi, I'm Robert Sharp, Public Health Division. 2 kids, one a junior at HB and a WNL graduate. And I've been with the county for a long, long time now. I'm going to pass it to Robin.
Hello, I'm Robin. I fall under public health. I'm a school health supervisor. I've been with public health for about 5 years now, and I have a middle schooler in Alexandria. So same issues, just different jurisdiction. And I will pass it to Alicia.
Hi, everyone. My name is Alicia Guajardo, and I'm a member of the partnership and also co-chair with Judy, the Youth Mental Health and Wellness Committee of the partnership. I serve on the Student Services Advisory Committee with APS, been involved in that for a while, and also with with SPAN, the Suicide Prevention Alliance of Northern Virginia. I don't have kids in school any longer, but 2 of them went through APS and 1 through private schools. So glad to be here. Thank you. Let's see, Laura Newton.
Good evening, I'm Laura Newton with APS. I'm the Director of Student Services, and I do work with Judy and Alicia on the Student Advisory Committee. And how about going with Rick?
Hello, I'm Rick Strobeck. I'm being told not to talk so loud. I work at the Court Services Unit. I'm Deputy Director of Court Services. I actually have 4 children who are former Arlington Public School students. And I'll pass it to Grace.
Wow, I'm almost never like up front. I'm sorry, my video is not working. I'm Grace Wagner. I'm a data specialist with APS in the partnership. And I, because my video is not working, am not able to pass it to someone. So Sally, can you just name someone? Because I only see 3 people.
Or Catherine is joining.
Thank
She
you.
just got up to walk around though. So maybe I will give it to Dina and give Catherine a minute to sit down.
Yeah, you got it. I'm Dina Little. I am the Assistant Chief of Public Services for Arlington Public Library, and I also oversee youth services for the organization. And I will pass it on. I think, John, I don't think we've heard from you.
I'm John Andelin. I'm a member of the partnership and its Youth Mental Health Committee. I'm also a member of the Arlington Community Foundation and have just had the pleasure of reading a couple hundred scholarship applications. So I know a lot more about the high school seniors than I might have 2 months ago. And because they are amazingly candid, I can actually provide some information to this evening's meeting. And I will pass it on to Kathy Paul. I believe, Kathy, you're a guest tonight, and her official title would be working at Thrive in a role that's not so different than the navigators we're going to talk about.
Thank you, John, for the introduction. Yes, I'm Catherine Paul, and I'm the program manager at Arlington Thrive. I oversee the case management team there of our case managers who provide emergency assistance to Arlington residents in need. And I'm excited to learn more about what you all are doing and hear more about the navigators idea that you guys are going to be discussing.
Catherine will pass for you. But now that I've said that, let's see. Robin, did you go?
Sorry about that. I forgot to pass.
Sorry.
I did go.
Dave hasn't.
Dave Carlson, I'm a member of the partnership and have been since I think 2012. Both my kids went from kindergarten through high school in Arlington Public Schools. They're both out now. My daughter's teaching law in Macon, Georgia, and building a domestic violence clinic there for her students. And it's pretty interesting. My son's doing real well too, and he's local.
Hey, Megan, can I just say, I would feel guilty if I didn't say, my kids went through, 2 kids went through Arlington Public Schools. And now I have 3 grandchildren in Arlington Public Schools. And then I have 3 up in Arlington, Massachusetts in those schools, which I wish they were here. I can't forget them. Last night I wouldn't have been able to forget them because they were kind of running circles around me here. But I just couldn't leave them out.
Lynn, did you introduce yourself? Yes, maybe briefly.
I think we got everybody.
Yeah, I think everybody's, yeah.
Anyone raise your hand if you haven't gone? Great. Okay, so I hope did everyone go? I hope you've seen the agenda. And I will briefly talk about how we're going to run through this tonight. We don't have speakers tonight, so we have time for conversation. First, we'll have some updates. I don't know if Grace has a data update, but I'll let her go first, even if it's a recap of what we've heard, since everyone wasn't on the last meeting. We will take a brief report from Youth Mental Health and Wellness Committee out of order, because I think that'll be a good way to frame our discussion. And then other updates and announcements after that, and next steps. So with that, Grace, I want to turn it to you.
Sure. Well, good evening. let's try to plan these on nights when it's not as beautiful, if we can, so that I can just be outside while we do this. So data, we've got 2 survey pieces that we're waiting for data for. The Virginia Youth Survey. I think I shared this last time, but I did reach out to our contact at VDH, and the data was supposed to be available sometime in April. They already know that the CDC is behind though. So there is no official date on when we'll be getting that data. However, if you have been watching the news, especially those of you on that youth mental health and wellness, you've seen that the CDC has kind of put out some executive summaries, some highlights that they're saying that students are really not faring well with stress and anxiety during the pandemic. They don't give specific facts. It's just been headlines. I think NPR did a story a couple weeks ago. So I believe that is all going to be coming from our survey, as well as the other youth risk behavior surveys from across the country that were gathered in the fall. So that's your data in work. But again, Arlington data, we do not have yet. And when we get it, we'll get it, and it'll be exciting. The other survey that we just finished is the Your Voice Matters that closed on Sunday. We had an amazing turnout for families. We got 24.9% of families responding, which is crazy. It's just amazing how many families turned out to respond. I think 2 years ago, we had something like 21 or 22%, maybe 19, but it was definitely more than last year. I think Discovery had the highest with 37.9% turnout, which is, again, phenomenal. The student survey wasn't as great of a turnout. We did everything we could. It really comes down to the schools themselves. So we'll see if there's anything that comes from that. But we have enough turnout from all schools to provide data, I believe. But we'll see what that comes out to. I have a meeting tomorrow. And so we've got those 2 things, and they're done. The administration is done. And now we're just kind of waiting on our partners to analyze the data, and we'll get some numbers. Your Voice Matters is really simple. They'll just be providing us a platform that we can then just share out and maneuver and play with, and it'll be fun and exciting. That's what I have.
Thanks so much. And we also heard from Dr. Devaney that the SEL survey closed this week. So we hope that she'll be able to talk to a future.
Megan, I can talk about that. It falls under student services. So I
Great, Laura. Sure.
SEL. Yeah, the window for the survey was March 21st to April the 8th. And just like the Your Voice Matter was extended until after spring break, because we felt like we wanted to give students the opportunity to make up, that. So it stayed, open after spring break for a week. The results are not going to be back until probably the end of May. We had a meeting with Panorama this last week, and if everything goes well, we should be able to provide the school board with results on the 26th. If for any reason there's a hiccup, then it would be early June. The results will be shared with the parents. We are going to send the reports via parent view, and so they will be able to see individual reports. And just like Grace said, we will try to have a platform where we will have general trends so that you will see what are areas of strength for APS and areas of improvement. And also, I think that Panorama is able to desegregate the data, so you will be able to see how different groups did as well.
Great, thank you. Okay, so let me say a couple of things. Does anyone have any questions for Laura or Grace before I move? Okay. I wanted to say a couple of things and then turn it to Alicia and Judy and others who have been attending those Youth Mental Health and Wellness Committee meetings, just to set a frame because they've had an interesting series of meetings and heard from a lot of mental health providers around our schools. So tonight's conversation really came out of, besides a priority of the partnership, which has been youth mental health and wellness, came out of the discussion between the school board and the county board at the budget work session on April 8th. I presented our testimony at that meeting. TNB submitted a statement, and then the school and county boards discussed for a good, 20 minutes or so the report that I had given, the data that was shared from our prior surveys, and really shared a lot of concerns that they have. The context was also fresh for them because the initial the initial school budget would have cut 2 psychologists and 2 social worker positions. So that was the context. That was based on numbers and not ill intent, or misperception of the need, but just based on enrollment numbers only. And so the school board changed that plan pretty readily. But it had, gotten school board and county board members thinking about these issues as other things have, the news and data that people have been reading about. And so our school board liaison, Mary Cadera, who unfortunately is traveling this evening, so couldn't join tonight, during the course of the conversation said, I'm hearing concerns all around the room. And she suggested initiating a multi-year plan between school and county boards and the community to see how we could address see how we could contribute to a county and school effort to address youth mental health and wellness. And building on that, I wanted to think about how the partnership could contribute to a countywide effort through our advocacy, convening, amplifying the great work that we know is already going on at DHS and at the schools, but also making sure people are aware through our data of disparities. And so not having seen the data, but looking at prior data, and this is what we reported out to the boards, there, and you'll all remember, there are disparities in outcomes for children who are Asian, Black, Latinx, LGBTQ, and girls in the different categories, across the different categories. So in some of those groups reported higher suicide attempts, depression, lower levels of receiving help, or of having a trusted adult to go to. So, this has been a priority for this group. And that's what I'm looking forward to talking about. But I wanted to let youth mental health and wellness jump in and talk about some of what the committee's been hearing from school staff over the past few months. So Alicia, can I turn it to you?
Sure. Yeah, I can start out, and then Judy and others who've attended, of course, invite your input as well. Over the last few months, with real great help, thanks really to Judy, of helping to and others to bring at each meeting some of our professionals from the school. So we first had elementary level, then the next month was middle school, and it was a mix of during this time of counselors and social workers, psychologists. And then this past Monday, it was a focus on the high school, and we had 3 really amazingly kind of experienced, knowledgeable, committed school psychologists that joined us to really share a bit of the realities of what they're seeing, what they're facing, what they're dealing with, with the students, with the families. And we had great participation. We had, I think, about 18 to 20 folks that had joined from different partner groups and some of our regular participants at the meeting. A few of the messages overall, the numbers have gone up. So more students just overall needing help in more kind of serious ways, acute ways. They gave some numbers. I don't have them right in front of me, but I know one that stuck out for me was at Washington Liberty. So far this year, they've had over 109 suicide risk assessments just in that area so far this year. They talked about the increase in the number of 504 plans and IEPs. They also talked about the increase in overall substance use as part of that. One of the areas that they shared with us, and all of them really talked about this in their respective schools, was around attendance. And they basically were saying that students aren't making it to school. They're not getting there. And so even with the help that they can provide in the school setting, if they're not getting to the school, then they're not going to be able to help them as well. Sometimes parents are calling in and asking for a mental health day, excusing that. And so there was some discussion around that, kind of the pros and cons of supporting, I guess, what a parent might see as supporting their student in taking a day off, which can often really have that snowball effect, because being absent creates more stress, more anxiety, because now you've missed classes, you've missed a test, you've missed whatever, and it's harder to get them back to school sometimes with that. Let's see. They said another thing was that many of the students have come back to school since the last 2 years, and don't have adequate coping and self-regulation skills. So it's harder for many of them to manage the stress that they are facing. On the part of the professionals, the student services professionals in the school, of course, all this requires a lot more time, more meetings, more phone calls, more evaluations. The entire student services team as a whole, they're swamped between all of the ones I've mentioned, the counselors, the social workers, and the psychologists, but also substance abuse counselors, their interlude therapists, their attendance specialists, all of them. They talked about referrals to DHS, as well as out in the community, and how they're all families face long wait lists that we've heard about, and that that's really the DHS is very overloaded, and which of course we have heard about already, but really throughout the community, not just DHS, that you may face 3-4 months, maybe even more, to even get in to see someone in the private setting as well. We did ask the question of what can we do? What could we do? And there were some different things that they shared. For example, they would like to be able to do more parent education types of things, as well as for their staff. But again, going back to their swamped, where is the time to number one, develop something, and number two, then to really carry it out. But in the school setting, lunch and learn type things. And they talked about, partnering with, whether it's PTAs or, with the partnership in terms of convening groups. And then a couple last things, and I'll turn it over to the others in terms of what are some things that we can do to help. Certainly, again, is this issue around attendance is helping to reinforce the importance of doing your best to get your student to school. You can, because at least then that gives them more of a chance to intervene and to support that student. Something that the partnership has done over the years very well is convening community conversations, and they thought that was a really important one, is to be able to have a setting where we can have these hard conversations about these topics, and talk about things like communicating with your child, It doesn't just mean talking to them, but listening actively and paying attention to their behaviors and things like that. And then they really like the idea of just ongoing education, both for the students. So having like wellness days or even a week where the students go to school and they do their rotation of classes, but they're not doing the regular classes. They're learning about social, emotional, mental well-being and participating in different activities that supports that. And I think maybe I'll just stop there because I want to give a chance to Judy and John and Megan and others that were at the meeting if they'd like to add anything. Thank you.
Thanks, Alicia. Yeah, the resource staff, the people who were there last night, two are school psychologists, one at W&L and one at Wakefield. And then there was also a school social worker who was there. And it was tough to listen to them. I mean, this is our second meeting in a row where it was really tough to listen to the staff who were there sharing information with us. But I was just thinking of the social worker who goes with many of the students, takes them to DHS or wherever it is, goes with them. She doesn't just sit in her office, and you could tell, I mean, she didn't say this, but obviously very hands-on to make sure that the students get where they need to go and learn what they need to learn in terms of services. And let's see, she, one thing that I thought, I mean, it's good to know, well, it's important to know, I should say, and I don't know how Laura feels about this, Laura, but I've always felt like, the school psychologists who, are working with kids on all these different issues, along with the social workers and others and counselors in the school. The school psychologists are also responsible, not all of them, I think. Laura will have to help me understand this better, but for kids who need to have, are having some learning difficulties, and there are, this, what do you call it, the IEP?
IEPs.
Yeah, and I know that they said at, I think it was at Wakefield this year, the number of students who have qualified for, need an IEP has so far been up to over 500 students in the school. And those, I don't know if anybody's heard about those meetings. My daughter happens to be a teacher, and I hear about those meetings, and I've known school psychologists. They aren't just let's sit down and talk about this. They involve several meetings. Laura can tell you more about it. Several meetings and writing things up and meeting with parents and the meeting with the students. And this is on top of what these school psychologists are doing for, right, Laura? I mean, some are dedicated to the IEPs and the students who need that kind of help. But
you want me? Yeah.
Can you explain?
Okay, so psychologists, we assign usually one, well, in the high schools, in this case, we have 2 psychologists and 2 social workers assigned to the schools because their caseload is great. In the case of the school psychologists, they're responsible for psychological evaluations, they're responsible for counseling, and they are responsible for consulting with parents and teachers. What, earlier you said that the number of IEPs and 504s have gone up. So anytime that a student is referred, to a meeting, an IEP meeting, you have to meet. And then if it is agreed that the student is having a learning, barrier, they do a psychological evaluation. The psychological evaluation may take a full day or even longer. So because they have to sit with the kid, they have to do a battery of tests, and then they have to evaluate it, and then they have to write the report. So imagine for every kid that goes to a meeting, the time that they spend at the meeting, then they have to spend a full day, if not more, doing the evaluation and then writing the report. And then of course, you have to meet again with the family or the multidisciplinary team in order to report the results. So in evaluations, they spend, I mean, just talking about meetings, the psychologists and the social workers spent, I would say, the majority of their time, 60% of their time. Then obviously, we want them to do consulting because within the IEP, many of the students need counseling. So they spend a lot of the counseling that is written on the IEP with the students. So that takes a lot of time. But they do consulting. They want to meet with the parents. They want to meet with the teachers. And 2 psychologists for a high school that has close to 3,000 students is not enough. Social workers, they do the cultural evaluation. So that means that they also have to hold these meetings, and they have to meet with the families to write a report about the history of the family, which includes medical and family, history. And that takes a long time. I know that also many of them do the attendance, and you're saying there's attendance issues. When you do attendance issues, we need to follow state law, which dictates that you have to meet with the family if there's 5 unexcused absences and come out with an improvement plan, or, what are you going to do? Why are you missing so many classes? And so that requires time. And many times, that identifies family issues, other issues that are going on in the family or with the student that you have to pursue. So, like you heard on Monday, it's overwhelming. They're overwhelmed. There's not enough time to do everything that they want to do. And so they may think that, we need to meet with parents and do more with parents, but they're overwhelmed. They just don't have the time to do what they want to do. And we have partnered with the Parent Resource Center. And many times we do, like, for example, right now we have partnered and do the lunch and learn. And these are like virtual online teachings where they try to talk to parents about different issues. So I know in February they cover the 504 and how, when do you apply for a 504? What is the process? And try to help them out. In May, they're going to talk about anxiety. They've talked about different things. So, I mean, we have really tried to do as much as we can, but not enough people. And that's why every time you see that we are recommending to get more staff. And one of the things, Judy mentioned that last night we have our student advisory. So Judy has been on meetings every night, Monday with, the mental health roundtable, and yesterday with the student advisory. That was where I was yesterday. And I told them that many of our staff, like everybody else, teachers and everybody else, they have been impacted by COVID, which means that many of them are on family medical leave because of family issues. This brings an issue of capacity, meaning, do we have enough staff to cover all our needs? Because if someone, let's say you have 2 psychologists assigned to a school and one of them is in medical leave, you only have 1 left. How do you cover for all those cases where, you don't have enough people? And so in addition to covering your school, many of the psychologists and social workers are helping other schools get, the evaluations done or try to do the counseling that is written on the IEP. And so the staff is stretched to the limit. And Jamie is here from, the HS, and she'll be able to tell you too that they are short staffed. So the crisis is we don't have enough professionals. There's a shortage of professionals to deal with all the issues that we're having right now. And I know it sounds horrible that we keep on asking for staff and people think that, you have enough, but, these are, real issues, and you need to have people available to help them out. And they, as humans, have issues too. So you have to take into account that some of them are going to be out and they're not going to be available. So I'm sorry, I hope I answered that, and I did not.
You did a great job. But I do want to say that, and see if Alicia agrees with me. Last night, listening to the staff, mostly what they talked about is how much they love their jobs, how, you know, the kinds of things that, you know, they do with the students to help them, what they wish they could do, go out and do. Oh yeah, and you heard this too, Megan. You know, and John, they want to do more. They weren't sitting there complaining about, oh, it's so hard, you know. But the reality is, they're very they're overworked, it's very stretched. And I will say that, yes, Alicia and I have been part of the Student Services Advisory Committee which is part of, you know, another committee. It's the Advisory Council on Teaching and Learning. It's under that. And we've been on that for years. And we have, over the years, pushed for more psychs and social workers. And we are again this year, because you can imagine hearing about all this work that's going on, and you have two psychs and 2 social workers
at each of
the high schools. Each of the
middle school is only 1, and in elementaries, you don't even have 1 assigned to each because we don't have enough. So some of them just go to 2 different schools, so they're part-time at each of the elementary.
Right. So year after year, we come back, and some years we did get more counselors because we're really low on counselors for a while. But this is when you hear that, you know, this group of crazy people is, you know, lobbying for more staff. You know, we need it. We really need it to help do what needs to be done. I do wish, you know, I don't know, it's hard to understand how we can expect to have school psychologists have, it's like 2 jobs. Their job is doing all these evaluations, but it's also working with students with really major issues, or, you know, maybe it's not so major, but they need to talk with them. We really, man, I wish we had dedicated psychologists for all of, you know, for the testing and the meetings and things like that. But that's just, you know, that's just me. But anyway, so support us when we ask for those extra psychs and social workers. We heard last night that kids are, when they're home, they really disengage from school. It's not like they're at home and many of them they're not, you know, doing homework while they're home. They're home, a lot of them, because they're sad, they're depressed, they have, you know, mental health issues, and they're tired. We heard that last night. They're tired and exhausted. We were told last night that the kids that we could assume that the kids who are freshmen they are equivalent to what did they say, Alicia, like an 8th grader or a 7th grader, because of COVID and being home for a couple of years. So you could take 2 years off from each year that those students are in school now. And that's, you know, kind of emotionally, mentally, you know, just everything, motivation wise, a lot of them, that's where they are, which is something I really hadn't thought about. They're anxious. They're lacking in coping skills. So I'm trying to see what else you know, what the counselor or what the psychs were telling us last night is, you know, kids need to get back. They do need to get back to thinking that school is the job that they have right now. They really need to be serious about it, but it's really it's hard for them to do with all the issues they have, and sometimes parents decide that it's too hard for them and maybe give in more than they should to not doing the homework or staying home. Attendance is a huge issue. What else did we hear, Megan? or John?
I was going to say, I hope we can spend 1 or 2 more minutes and then open it up to the bigger group for some reactions and discussion as well. So
Yeah,
I had
and-
nothing to add, Judy. That was very thorough.
Okay, and
I'll take a quick minute or two.
and we had the video. I just want to tell everybody, we did a video last night, and we made a video when we had the psychs and social workers from middle schools. So we have both those videos so you can watch it, and they last about an hour, hour and a half. So we'll make sure you have access to those.
We had,
Sorry, John.
as was mentioned, we've had 3 meetings, elementary, middle, and high school with various mental health professionals. It was striking both their ability and their compassion and their dedication. They are everyone, you want to say, thank you, thank you, thank you. They said that they're getting support as much as possible, but the support isn't available because everybody else is swamped. And so I give them all awards. All of you guys in mental health deserve these things right now. That the comment was made that the students really don't have parental support at home the way they should in terms of pushing them towards school. So a student will say, I need a mental health day. And instead of saying, how can we get you help today for either the academic side of life or your mental health issues, they say, oh, okay, I'll make it approved. And so as overworked as these counselors, psychologists, social workers are, they were saying, we want more kids in school because when they're home, we can't talk to them as easily. We can't watch their body language to even see who we might even initiate conversations with or tell somebody about. The teachers don't get to see them to refer them to us. They only get deeper in the hole. So attendance, attendance, attendance. Let parents learn how to be parents. And so one of the recommendations that came in effect was, how do we reach more parents to tell them to get their kids in school? And whether that should be senior people at APS, civic associations, PTAs, the press, I don't know, but parents need to be told, at least told, whether they can act on it or not, that getting your student in school is really important for their mental health as well as their academics. One of the counselors was talking a little bit about stress and said, it'd be really nice if kids didn't go to college before they're in college. Namely, there's too much pressure for IB and AP for kids that don't do well. I've heard that before in a number of meetings with our substance abuse counselors, and they're saying the same thing. Some of the kids they're getting are because of the academic pressures by the expectations. The students, according to these folks, don't have coping skills, by which they mean if they don't get a really good grade, they think they've failed, which is very different than they should think, I don't know enough yet. So they don't have this concept of yet. They have it, if I don't know it today, I have failed. I'm a failure. Once you're a failure, you stop trying. So they're really worried about the academic, the interpretation of academics, not the pressure necessarily, but the interpretation of what happens when you get in a tough class. Get in a tough class, you should say, I'm wonderful. I've got a lot to learn. That isn't what they're doing. So there's a lot more from last night or the night before, the last 3 meetings, but we'll pick it up as we go.
I see Lynn's, thank you, John. I see Lynn's hand.
Yes, I have a question. I appreciate the recap of the 3 meetings. I attended a couple of them. They were very helpful and useful with information. Now, did you guys get a sense of, additional context or demographics of students who have been struggling and not coming to school? Do we have a sense of any kind of clusters of kids or any kind of disparity in demographics perhaps that is contributing or that is in that group that we're talking about?
If I may answer, I think that you're seeing that with the pandemic, it has affected kids of all socioeconomic backgrounds and all ethnic and races. Sometimes, low socioeconomic, when parents are struggling and have less, supervision, or, maybe that, they struggle more with the attendance issues. I've been working with the juvenile court, and Rick knows this, in order to try to look for what we call diversion, meaning that when we see that kids, exceed a certain number of absences, we meet with them to try to figure it out, what can we do to help? And in general, when we do that, you see that a lot of parents feel a sense of helplessness and hopelessness. They don't know what to do with the kids. I don't know how to make them get up in the morning and get them to school. They just don't feel like doing it. Some of the times we have a lot of kids that are struggling, not just with depression, with substance abuse. And so it seems like it's not just one issue, it's many issues that is happening. We are seeing, unfortunately, there is bullying, and there is, situations where kids don't want to go back to school because they don't feel safe that they can go back to school. So you're seeing different reasons for different folks, but in general, it means that when you see that there are attendance issues, that's a flag that there's need for assistance. And so when what we've been trying to do, because attendance specialists are the ones that deal with attendance at the high schools, and social workers deal with them in the elementary school, and trying to, really identify what are the issues and working with the families to help them out. Resources, what we need to do is, I really think that parents need resources as to, more parent support groups, like, okay, my kid is struggling with, and these are some strategies that we can do that. I remember before the pandemic, we used to run parent support groups through the diversion, and parents would come in and they would hear each other. I think that that's important. It's nobody's fault. It is normal for kids to, go through, learning, like how to deal with their emotions, how to deal with situations that they don't know how to handle. And parents, if they don't have other kids, it's the first time they're learning as well. So we need to have more, in my concept, more parent support groups. Like, okay, what would be some strategies that you can use at home to help the students? It's not like last night we were talking, nobody's to blame. We don't want to say, kids are not doing well or parents are not doing well. I think we need to find out, where is their area of growth, and what strategies can we provide for them in order to help them overcome this, because behavior is learned. And so if we can teach them the right strategies, I think that parents can do better and kids can do better. Anytime that they have an issue, you learn how to cope with the different situations. So just my 5 cents.
Yeah, Laura, I definitely agree with you that the pandemic, is a neutralizer on many factors, that it transcends, many demographics in our society. It's like a leveler to some degree on certain things. However, I keep, I'm stuck on the 2019 data that we have pre-pandemic, that I was very happy to hear Megan presented to the board, of the disparity. And you were very clear about, highlighting the disparity of African Americans, youth, Asian American youth, Latina, in terms of really extraordinarily highly represented in depression, self-report, for example. And so one would postulate that those are the groups that were most prevalent in those symptomologies, that given the pandemic and all the challenges there, that population would also demonstrate extra challenges through the pandemic. And I wonder if those numbers show up higher in those who stayed in school, stayed home and are not connecting and are struggling with social emotional learning and academic progress. So that's just where I was kind of going with that. And I think that that's a nice way to maybe dig a little deeper to see if we have that.
What we have found out in the past, that when parents have the resources to to get, outside help, whether it's in academics, whether it's in mental health, kids do better. So of course, if the parents don't have the means to provide those supports outside of school, then those kids are going to struggle. So yes, it is true that you're going to see maybe members of low socioeconomic where the parents don't have the means or they don't have the time, to help the kids with, the additional support with homework or hiring a tutor or, getting extra help outside of school, that they would struggle. But again, we would have to look at the data. And I think that that will, guide us really where we are.
I saw Jamie's hand go up and then down. Jamie, did you have something?
Yeah, I was actually looking for some data, so I thought I had it, and I'm still looking for it. But in terms of what DHS is seeing, because I know I also watched the county, the school board work session, and would love to talk to anyone who's interested to know what we're seeing at DHS. But just really briefly, we are seeing similar things, but Lynn, Megan, in your testimony, you referenced the data, and Lynn, you just discussed it as well. And so it's interesting that the DHS or children's behavioral health population is mostly Latinx females, 12 to 17, diagnosed with depression. So that's exactly who we're seeing. That's who's coming to our doors. We are seeing kids that have higher clinical needs, more complex situations, more significant mental illness, youth that are in and out of the hospital despite interventions. And then parents, I think something that would be helpful is for us to get a gauge on what parents think that they need, because sometimes we identify things that we think that parents need, but they can't access it because they're at work, because they're so stressed out themselves, they can't come to a meeting or can't come to a Zoom meeting or just can't, they have like a couple hours when the kids go to bed and they don't want to talk about things anymore. And so we're seeing that with therapy as well. We're seeing parents that have a lot going on themselves. COVID, is still here and people are still being impacted by it. And so we have parents that are feeling overwhelmed, that don't know what to do, that despite their best efforts, seems like, it's not helping. We do have a lot more kids that have suicidal ideation and attempts. Whereas I would say pre-pandemic, suicidal ideation, but not as many attempts. And then with the state of with the capacity of the state hospitals, it's more difficult for youth who need hospital beds to access them. So we are working with emergency services. There is the diversion first position that the purpose of it is to divert youth from the hospital. And so someone was recently hired into that position who's been with the CSB for some time. And so we're working with them to help families that have more intensive needs. As you know, CR2 services went lifespan, and Medicaid has changed the model for mobile crisis. So I think we're seeing this similar things that the school's seeing, that the court is seeing with their kids. It's all the same kids, right? And they all go to school. So we're seeing some similar things and have some similar challenges that Laura describes in terms of her staffing. I know that we've had a significant influx of calls over the last couple of weeks. So, and intakes as well.
I'll say one thing that you reminded me of, Jamie, from the meeting last night was they mentioned specifically with the Latino population, they mentioned that a couple of the organizations, Catholic Charities and Northern Virginia Family Services also have 3-month wait lists. And so those are places that could offer bilingual services or services in Spanish, and we can't refer to them right now. I did want to say, because this came up at the board's meeting, that one thing that the boards were interested in is, or mentioned as well as some of the other concerns, was, what kind of gaps can be filled in addition to or before we manage to hire psychologists and other professionals, since the demand is so high and it's so hard to find staff. Are there other things that we should be thinking about? And this may get back to what Mary Cadera has in mind for a multi-year plan, but I'm thinking, this gets at prevention and Lynn's and team's work. Are there, ways to address issues before they become bigger issues? Are there other other services or volunteer opportunities in the community? It's not atypical for boards to think of things that aren't county funded, but that the community can offer, but that's where we might be able to help as well. So I want to make sure that's part of our discussion.
Yeah, I did notice that she mentioned that. And I think that's also important because there's other ways to help connect kids and to help them with emotional regulation other than just therapy, right? So activity like Parks and Recs activities, we just had Parks and Recs come to DHS to present so that we can be sharing those activities with the families that we're working with. We know that's really helpful for young people to be attached to different type of recreational and movement activities. In children's behavioral health and in the CSB and in the state of Virginia, there's a real push for folks with lived experiences. So we're in the process of hiring a bilingual family support partner. We do provide bilingual services. Most of our, like I said, I think it's like 45% of our, and we'll be reviewing our data at our next Child and Youth Committee meeting. But most of our youth that identify as Latinx also have families that prefer to have their services in Spanish. And so most of our bilingual staff's caseloads are higher because of that. But I think folks that have lived experiences, so peer recovery specialists or family support partners are excellent resources to help families to navigate complex systems, to help them organize and to be a support. They're not a therapist, they're not a case manager, but they're someone who's been there and has, come out on the other side.
Can I, because we do have Catherine with us tonight, maybe give Catherine a few minutes to talk about Thrive services and what flagged it for me, Jamie, is specifically what you said about having people from the communities serving the communities, which is what we've talked about a bit for a navigator model. So Catherine, can I request that you give us a few minutes?
Absolutely. And I've really enjoyed hearing this conversation. I have a teenager in high school in Arlington, and he's had his share of struggles. So it's really nice to hear all the efforts that are being put forward on behalf of young people, in Arlington. And I think it's so complex, and I love some of the ideas. I love, Jamie, your idea about the teen, peer support. And I think thinking outside of the box and these kind of times is the way to go. But back to Thrive. So Arlington Thrive offers same-day emergency financial assistance for a number of different needs. Most of our requests come in for either rent or utilities, but we also offer support for medical, dental. The amounts are not super high. So sometimes, like for example, dental expenses can go up into the thousands, but we can help at least partially and refer them to some other resources. We also support with, gosh, I mean, we've driver's license fees, moving expenses. We have on our website, you can see all the different types of expenses that we cover. And really the main requirement is that you be an Arlington resident and that you be referred by a case manager of, you know, a nonprofit agency in Arlington or any program in DHS. So we do ask that the person be, you know, referred because there are some eligibility criteria for the different funding sources. And so we train our partner agency staff on the different funding sources and kind of what the eligibility criteria is. I mean, it's mainly income level. And then we also train them on how to submit the funding request through our database. It's very easy once you learn it, and it really is same day. So we have a portal, it closes at 2 p.m. and then all the requests that have been put in that day, checks are cut and they're taken over to DHS, and either the client or the case manager of the client can pick up the check that same day. And then my team, they are all also trained in doing resource and referrals. So we refer to AFAC, we refer to behavioral health, the housing grant, you know, other housing programs, mental health. So I'm very familiar with the long waiting list for mental health. We've had several clients request those kind of referrals. So, you know, we don't stop with the emergency assistance. We try to connect them with whatever resources they might need without being too intrusive. So we just kind of ask the question and we let the client share what they're comfortable sharing. And so that's that's in a nutshell, that's what we do.
Catherine, I'm sorry. I said that people have to be referred. Can schools refer it, or do they have to go to DHS?
Absolutely. Mm-hmm. We have a lot of referrals from school social workers.
Thank you.
Mm-hmm. Yes.
Imagine from school health nurses, then maybe too, that would be appropriate.
Yes, absolutely. Awesome. And if you are, you know, interested in, you know, referring clients, I can set you up with our kind of director of operations, and she can provide you like a little tutorial on how to submit requests through the portal.
Okay, great. Thank you. Yeah, I wrote down your name. I'll be reaching out. Thank you.
Sure, absolutely. Yeah, we also work with Virginia Hospital Center. I mean, we work with a number of different nonprofits in Arlington, the free clinic. So school nurses are more than welcome.
Thank you.
Does anyone else have any questions?
Not a question, but I just want to say thank you so much. I mean, Thrive does tremendous work. I know that DHS has been working closely with your team, and you know, you help so many of our clients and low-income residents. And I'm glad to hear that it's more than just DHS, because I thought, you know, that we made the referrals, but it's great that nonprofit partners can do it too. So that's just my 2 cents. Thank you.
Sure.
Can I ask Catherine, so who do you have on your team, generally speaking? Do you have people from the Arlington community, and what resources do you provide your staff so that they know what's available, where you can refer clients out?
Sure. So we do have some staff that are Arlington residents. I'm an Arlington resident. Our executive director is, our quality assurance manager. Most of our case managers are actually not. I just think it's mostly a question of housing affordability. And most of our case managers are social workers, professional social workers. They have either a bachelor's or a master's in social work. So they come with a lot of training already on, you know, providing how to assess needs and providing, resources and support, and how to talk to people in crisis, because we do get, people are pretty desperate a lot of times. By the time we're speaking with them, they're afraid of being evicted. They're afraid their power is going to be turned off, or their power has been turned off. So we really do a lot of kind of, just soothing and calming in some of those conversations, and reassuring that there is support available. And we're so fortunate in Arlington that we have the resources to provide that kind of support. Yes. And in terms of, oh, I apologize, I'll turn off my ringer. In terms of resources, I actually put together like a community resource list for the team, and we just have it available. And so they can access that. They also have access to Virginia 211, which is a resource and referral service that anyone can use. DHS also has a social services wiki that all of the nonprofit sort of partners of DHS have access to. So we use that as well. So there's, I don't think there's really any shortage of resources. I've also worked in Arlington for many, many years, really since '99. So as well as living here. So I know a lot of the organizations in Arlington. So I can usually provide some guidance if it's an unusual request or something kind of not on our basic resource list. And I believe we're redoing our website, and I believe we're going to put the resource list on the website, because we really want to be like kind of a hub of information and resources for the community, because we really touch so many nonprofits as well as DHS, in the community. So, if we can support our partners by, providing these resources and updating it as needed, and so that they can just like look it up, go right to it, click the link. We really want to do that.
And then last question, how would you say you're resourced in terms of funding to meet the needs out there and staffing to meet with clients?
So I feel like right now we're well resourced. We have a contract through DHS. And I think that there's been a lot of good advocacy to, designate sufficient funding for, rent, utility assistance. There's also been a state rental relief program that's been really, really helpful. And we typically refer clients there who have like larger balances. But that program is going to be discontinuing accepting applications as of May 15th. So we are anticipating a surge of applications through DHS and Thrive after that date. So I might have a different answer after May 15th. We have to kind of see like how the workload is. Right now, it's pretty manageable with the team that we have. But I have heard that before I came on board at Thrive, I've only been with them since last summer, that really in this sort of the heat of the pandemic, it was just overwhelming. Just the need was so great. And at one point, Thrive had about 9 case managers. Now we have 5. So, it might be a question of staffing up again if needed. We just kind of have to wait and see kind of what the fallout is from the state program going away. They are planning on having some sort of step down assistance available through the state, but it's going to be pretty limited, and it's going to be really only for people who are literally about to be evicted. They're really having to focus it because it's not a lot of funding and it's got to cover the state. They're having to focus it on the absolute most, dire situations. But we're definitely seeing still the fallout, from the pandemic affecting families. Some of what you all were talking about, that's been affecting the mental health of children. I also think it's been affecting, adults and their ability to really like recover from maybe having, lost a job. And yes, maybe they've gotten a new job, but maybe it's not kind of at the level where they were. So their income has been really affected. And I think, families have had to make choices like doubling up or giving up an apartment, and then that creates a lot of stressors. So we're definitely seeing that, even though things have improved so much with the pandemic because of vaccination and other things, we're still seeing the effects on families and individuals.
Thank you. Any other questions for Catherine? Rick, do you want to say your question?
I had a quick question.
Sure.
Catherine, is your group the same group as Arlington Thrives?
Yes.
That is, okay. I've been looking at it for a while, and it's pretty interesting. I know financial literacy is a big part of that. And that's what I'm doing with a group kind of similar, Bright Paths in Fairfax.
Yes, we actually met with Bright Paths last fall to find out more about what they were doing.
Yeah, well, you can ask, I can tell you about that too, because I'd like to get involved with Arlington Thrives as well.
Oh, great. Well, yes, I'd like to follow up, with you.
Sure.
Our staff did take a training. It's called Financial Social Work, and it's like a certification that teaches you how to help, clients with budgeting and saving,
Sure.
Of course. But it also looks at more like the social-emotional aspects of finances and money, and it's a really great training. So we did provide that to them last summer, and but we also, we're kind of interested in the possibility of doing something in that realm of financial literacy, because of course, the people that we serve really could benefit.
Yeah.
Yeah, so I'd love to get your, contact information, and, maybe if you want to put it
Sally
in the chat.
has it. Sure, I'll put it in the chat, yeah.
Perfect, thank you. I can put mine in there too as well. I can put my email.
I'd like to thank Catherine for the information. It always amazes me how there are things out there that you should have known about all these years, and then someone comes to a meeting and opens a whole new horizon. So
oh, great.
Really appreciate that. I've heard of Thrive, but never really looked into it enough. I can see that. So it's so great that you're here with us.
Thank you. Well, and Thrive, to be, fair, Thrive has grown so much during the pandemic because we were brought on to help with just this surge in cases that DHS was receiving for assistance, during the pandemic. And so we've really grown in the last few years. So before we were much smaller, so we were providing assistance, but it was on a smaller scale. So maybe that's why you hadn't heard of us before.
Rick, I commented on what you wrote in chat, and I think I can envision where you're going with that in terms of drafting those steps. And what I like about it is that it takes a community-centered approach, right? Yes, we can postulate what the issues are from the data that we have, from what the clinicians are saying, what the school social workers are saying, and they're seeing the kids, but then to hear it from the families themselves of what the struggles are at home. And I think is an important ingredient that needs to go into what happens next. And so I think the community conversations is a good idea. It's a lot of work, but I think it's a good step. I also, I have my preventionist hat on, and I think this is an opportunity to approach the issue that we have at the larger community from a prevention perspective. And prevention, we don't have the luxury of like upstreaming at this point. It's almost like early intervention with what the youth are presenting in terms of concerns, right? It's almost like early intervention. And given the shortage of, behavioral health workers in every sector, we may need to turn to the community to heal the community, the self-healing approach of a community. And, you know, ACE, adverse childhood experience at the state level, is already jumping on this of you know, taking a very positive approach, a positive social referencing approach of, you know, they develop a program and it's not unveiled yet. It'll be in a couple of months at a community trauma informed conference. That this program is sort of like how you operationalize the ACEs principles, right? How communities can care for themselves, how families can care for themselves. And it's based on our resiliency. It's based on our capacity to use empathy to help one another, right? It's a very simple model, but you know, we believe that if this can spread in communities, it starts small and then it you know, it kind of spreads, that during this time as professionals are trying to increase their capacity, communities can do a lot to help themselves, at least to mitigate what's happening. Not to train them to become clinicians, but to mitigate the negative impact that we're seeing with our children and families. So I think that there, you know, there may be opportunities to take that approach, and the partnership can be, you know, an amplifier for such efforts in the community that is happening, that is going to happen, and it's not, you know, reinventing the wheel, but how do we maximize? And this is what, and I think of Mayor Cadera's goal of 3 years, that can be a community-wide, integrated, collaborated, coordinated prevention effort to lift the community in this approach.
That's right. We need to think about this at the micro and the macro level. And so, you know, taking that approach that you're saying, the idea of, I do think the community conversations have been very successful. It's the partnership is the right size for that kind of thing, because there's, you know, there's only so many of us. We can't fix every problem, but we can help people talk about the problems, meet with each other in a community conversation, and then, you know, sort of stimulate things beyond what we're able to do. And the other thing I was thinking about is this idea of having a toolbox, or just, you know, kids aren't coming to school. Well, this is what you need to do. And you just give them sort of a cart, like the Parks and Rec bins they have with activities in them, and they just pull it out and say, okay, we're going to have increase the number of clubs, bring in the retirees to do something, or, you know, just have something that everyone knows will help improve truancy, or, you know, teen depression, or lack of activities after school. This is not something we can fix, but we can tell people, hey, if you think this is a problem, here's some things you can do.
Jamie, I noticed you had your hand up earlier.
Yeah, I was just going to say that I'm glad you brought up the average childhood experiences. You went that direction, and I was thinking that as well. And I was thinking that this conversation, the partnership, can really be a vessel to help with collaboration, right? Because it's not just what's happening in the schools, but it's also the kids that are involved with court services, the kids that are coming to DHS, the kids that are involved with private providers. So kind of being a place where multiple stakeholders can come together and share what they're seeing. And then more than the conversation, but then how can we partner around doing something to support the community, in addition to hearing directly from the community what they feel like that they need, or what they feel like could support them. So I would definitely be interested in participating in discussions and strategic planning that brings multiple stakeholders together. Because something that we've seen is, yes, there is a nationwide, you know, shortage of behavioral health providers, but in Virginia, there are less people going into social services fields, social work programs, and counseling programs, and so that has an impact on us here in Virginia, right? And so I think pulling ourselves together to talk about how we can truly collaborate and outside of just the professional setting, along with community
Yeah.
members, is really powerful.
Mhm.
I like what Rick and Jamie are saying. I think we really need to think outside the box and create strategies, toolkits of what do you do when certain things happen. And the idea of, maybe tapping into the retirement community and see, what they can do. Maybe some people can volunteer and work with the youth, and do different things and plan different activities. Sometimes I think it's just having that mentor that, that connection with another person that, takes the time to talk to you and do things with you. Like the trusted adult, but at a different level. It's not, I do think that those opportunities are missing. Many times on the diversion program, we're saying, what can we send these kids? Because they need a safe place to go outside of school where there's structure, where there's activities, where somebody is taking the time to work with them and, and listen, not in a judgmental way, but just listen and kind of guiding them. And I think that our youth are missing that. If you see a lot of people, depressed, they lack it, they lack purpose. They don't know what they want to do. And, we say that school is a job, but you need more than a job. I mean, all of us have to make a living, but I think that people need to have a sense of, what's my purpose in life? Everybody has to work, but, try to find that. And sometimes it's talking to other people that can share their past experiences and what they have learned that can be very useful to our youth.
On the other side, what about partnering with Marymount University to kind of have like a big brother, big sister program, perhaps, like for their students to volunteer, since they are like, younger, but they made it to college, just kind of to share their tips and kind of relate to them on that level too.
I love that idea because I think one of the things that is kind of a barrier for teenagers is they perceive a lot of like activities and programs that are trying to help them as not cool. And if you show up at that or you go to that, then you're not cool. So they're afraid. But so I like the idea of maybe some younger people that could be kind of hip and like, I don't know, organize like a basketball game or, something that especially boys, are just so worried about being cool, and not that girls aren't, but I think like, boys find it harder to like talk about what's bothering them. So if it's kind of a setting, where it's an activity, I think that would be great. And with mentors, I think that would just be amazing.
One of the things I always like to think about is what is coming next and what can we do? The idea of, I've said it a million times, that, luck is nothing more than the opportunity and preparation when they get together. And, it seems like there will be opportunities to do these things. We just have to be prepared somehow. Even if we have a list of our, this idea of mentoring is a great thing. I think mentoring has really shown to be very successful. But like I'm saying before, we're not going to be able to do it. But we have a community meeting and someone says mentoring, and then, someone says, why do we do mentoring? And then someone among our group says, well, sure, that's a great idea. And, here's how you do it. And then you send them off because, mentoring, we have a mentoring program in the juvenile court. That's why I mentioned that we're always thinking about what can we do to make this a truly meaningful mentoring experience. And you really have to have all the elements ready for it to launch, It's because people don't want to start from zero when they have no idea what to do. But if you say, hey, every school in Arlington, right after school, the last half hour, professionals or whoever can come in, there's this teacher organizing mentoring, and then at each place it's different depending on what people need. But, mentoring, for example, the biggest problem I find is there's nowhere to do it. There's nowhere to actually meet because everything is, COVID has killed so many meeting places. But, schools would be a great spot to do that. Rec centers too, once the kids are coming back. Library.
Rick mentioned opportunities. I'd like to share a couple, but I need to preface it first because, as Laura mentioned, there's a capacity issue with mental health. So, talking about navigators, even if we had, the right systems and navigators, we still have that capacity challenge. But two things that are happening with the Virginia Department of Health is we're looking at sustainable funding for community health workers, which have been rolled up in the pandemic, but they're looking at long-term funding. So there's an opportunity there. It's the community navigator model. And the second thing they're also looking at is they've rolled out something called Unite Virginia. It's an information referral platform. I think it has a lot of potential. You can screen a client, do the eligibility, and then see what services they could be eligible for, and nonprofits can communicate. They rolled it out, during the pandemic, awful timing, but they're looking at, again, a sustainable platform. And if they come up with something that's viable, I think it might be worth, revisiting at a community level, because it could really help serve our clients. And my last 2 cents, all this great conversation about mental health, you probably do this already, but do we ever partner with the Community Services Board in terms of advocacy? Because they're really effective, with the county board. And so if we got on the same page with the same ask, I think it would make it more powerful. Just a thought. You probably do that already, but I'll stop now.
Jamie, you're being very quiet. Do you want to say anything about the Community Services Board?
Sure. I mean, yes, the Community Services Board is, they are, very effective in their advocacy. I think that that's where this collaboration piece is really key, right? And so I would love to see us be more collaborative in our efforts, so that because I think we're more powerful when we're united than when we're working, the different kind of angles. So absolutely.
I like to end these meetings at 7:30. I see we're at 7:30, but I didn't give any advance notice. So just to let you know, it'd be, let's see if we can wrap in the next 10 minutes or so. But I want to say, I think when I first started coming to these meetings, we had a bit of a round robin where different, outside groups would come in, or also some of our county liaisons would come in and talk about some of the work that they've been doing. And so I wonder, a lot of us have been in partnership meetings for a long time, but let's think about whether we're ready to, have a joint meeting with another group, or bring in a couple of special speakers from other places around the county that you all are in or work with.
And maybe the partnership could also go to other folks' meetings as well, to see, what's happening on that end. That could be helpful.
Mm-hmm. Thank you, Catherine. And hopefully some of the chat can be saved. I couldn't figure out a way to save it in my own notes, but it looks like some great ideas and links have been shared. Others who haven't had a chance to comment. I heard libraries mentioned. Kimberly.
Yeah, I was thinking about one of the programs that we've had for years and brought it back this year as well as it's called TAB. It's essentially during the lunches, because I think somebody mentioned having events during school lunch, but what they do is it's for the middle school kids. They do a high school version as well. And so the librarians get together with some of the APS librarians, and they do basically book groups during a lunch break. And it's been incredibly popular over the years, but just as much this year, which surprised me with all the adjustments. And they attempted it last year virtually. So I think a lot of the kids are really happy to be, back in person, and it's a great program. It's also an opportunity for us when one of the things we're really working on this school year has been engagement with the teens and trying to learn from them, like how else can the library support them in their needs. And it's allowed us to do surveys with them. Like we ended up with, I want to say 800 responses, which, as you know, like with any type of student, it's very challenging to get them engaged and to submit any responses on a survey. But we ended up, like, I want to say 700 or 800 responses from the teams. So that's been really fantastic. So yeah. And then another thing that we're focusing on for next school year is a more structured volunteer program for our teens. We do provide volunteers opportunities for the teens, but it's more hit and miss. It's not structured, it's not advertised, it's not something that we do across all locations. But that is kind of a big goal for the next school year. Is we're going to try to have it in place by September. Is more of, here's the opportunities we have, really engage with the schools, let them know so that they know which middle school and teens are interested in that type of work with the community. And in my experience in the past, it's a really great program to allow kids to, get a feel for if they want to work in libraries, if they are interested in that focus. But also we have a lot of kids that are interested in getting volunteer hours for scholarships or for, presidential award or what have you. It's a good program. So hopefully, like I said, over the next few months, we're gonna really structure that out and establish it system wide.
And then Kimberly, Parks and Rec.
That sounds cool, Dina. It kind of reminds me of the Park Corps program where we have teenagers who work with our staff in the summer and they end up earning a stipend and they get to learn about working in parks and working with adults. And I think that program, the application process is closing soon. And they also go through an application interview process, which is neat because sometimes it's the first time kids have sat in an interview. I totally want to change gears and talk about another one of our passion projects is little kids and preschool real fast. Registration opens on May 3rd for our second full day program, which has been supported by ARPA funds at Gunston Community Center. We have flyers, we'll keep pushing information out, but I just want to kind of let you guys know, because you're always the ones who kind of have your ears out, that we do have some outreach spaces available that we're really targeting. There's a reason why we went into South Arlington with this program. We have more space other places, but we felt like the program could be successful and reach the most families who need it in South Arlington. So that's why we're down at Gunston. And so we're really looking to reach out to families who need us. I know everybody will say they need us, but we also have a super robust fee reduction program, which will give up to 75% fee reduction if families qualify for it. And there's also hardship programs. So if families don't qualify for a fee reduction, but they've suffered hardships and they can't make the tuition, we can work rates out with them. So I kind of just wanted to push that out, just because it's really important that that this program is successful and that we're actually reaching the kiddos that we are hopefully intending to reach, and their families.
Thank you. And yes, that sounds like a perfect thing that we can also email out to our full group for those who couldn't join tonight. Other announcements, I've been remiss in not leaving that space. Or last minute thoughts. I'm practicing the full silence.
I think it was a fruitful discussion. I do feel like we need a part two to kind of begin to look at some of the next steps and some possible ideas that we can carry out.
I'm hopeful that Mary Cadero will be able to join us for our next meeting. We have a couple ideas. I always like to announce everyone is welcome to come to the planning and development meetings. They're open to members who can make it and community. Our next Planning and Development meeting will be May 10th at 5:30. Our next Youth Mental Health and Wellness Committee meeting is scheduled for May 16th. And they have their own email list. So if you want to be on Alicia and Judy's email list to make sure you're catching any scheduling changes, then you can let me or them know. And then our next full meeting is May 25th. Thanks, everyone. Great to see you tonight.
Thank you. Good night.
Thank you, Megan.
Good night, everyone.
Bye.
Thanks.